sort of treatments have you developed to alleviate TMD, or that is it compression in the jaw in some cases?
Yeah. Well, the TMD can be due to a lot of reasons. Okay, so it can be due to muscles, it can be due to the teeth and how the teeth fit, it can be due to the jaw joint, it can be due to the airway. So obviously, if the TMD is due to an airway issue, and the symptoms of TMD are essentially due to chronic, sleep disordered breathing, then we manage the sleep disordered breathing. So we would manage it with a sleep appliance along this lines
That's the pink thing.
Like a plate type of thing that you wear on the top and bottom teeth, and it essentially helps maintain the airway, holds the airway open, holds the jaw forward. So these little fang things that look a bit weird, that's actually critical to stopping the jaw falling backwards. Okay, so if the TMD is due to sleep disordered breathing, sleep apnea, then an appliance like that will help. Sometimes TMD may be caused by the jaw relationship, so the way the bottom jaw relates to the top jaw. Okay, so that is determined by the teeth and the position of the teeth and how the teeth interdigitate together. So if the position that the teeth are fitting together is causing a problem with the jaw, sort of pressure, compression in the jaw joint, or it's accentuating the retrusion, the how far back the jaw is pushed because the teeth lock the jaw into that position, then again an appliance like this can put the jaw or reposition the jaw into a position that's more comfortable for the jaw joint. Okay, so the acrylic is covering the surface of the teeth, so it's a nice hard flat surface. So we can essentially effectively put the jaw in whatever position we need to decompress the TMJs, the jaw joint, and take the teeth out of the equation.
How much power is available in your bite? When you see a pit bull dog, for example, bite down on something, you're not going to be able to prise those jaws open. So how much pressure does a human jaw carry?
When we're awake, then we have our brain is controlling how much pressure we can produce in our jaw between our teeth. Okay, because the brain knows that if we bite something too hard, we could hurt ourselves or damage the teeth or the joint. The problem is when we're asleep, the brain to some extent is taken out of the equation, and so we have this subconscious it removes the inhibition, so you can create way more force when you are asleep. So people have been they've done studies in this, and people can crush metal bullet casings and things like that, whereas if we try to do that when we're awake rather, then we're going to limit how much force we put on because we're scared of hurting our teeth. So at night time, and this is called bruxism, clenching, grinding. So bruxism covers the clenching, which is the static clenching, squeezing of your teeth together. The grinding is where we are moving our jaws side to side, but they're all under the same umbrella of bruxism. Okay, so parafunction, which is not normal function, and the reason for that people might clench or grind their teeth is, there's a couple of reasons. The people often blame stress for grinding teeth. Now, lots of children grind their teeth, and I don't believe little kids have suffered from stress. So I think the two reasons people are grinding or bruxing at night are to protect their airway, and also to subconsciously the brain is trying to correct the bite or how the teeth fit together. Okay, so in terms of the airway, the grinding or bruxing, it braces the jaw, so it stops the jaw falling backwards and obstructing or blocking the airway more. So by bracing the jaw, the jaw can't fall backwards. Okay, this can obviously then cause muscle fatigue, muscle tension, which then leads to headaches and all these other symptoms of TMD. So if the teeth are not fitting together properly, so if part of the cause of the TMD is the jaw position, then again subconsciously the brain is trying to grind the teeth into a better position. Okay, so wear the teeth flatter so that the top and bottom jaw are related better and not causing the TMD.